Hey everyone, and welcome back to the Deep Dive. Today we're tackling something that I think will resonate with a lot of you, especially as we get a little bit older.
Yeah.
We're going to be talking about degenerative disc disease.
Uh-huh.
So we're going to break down exactly what's going on in your spine.
Right.
Separate fact from fiction.
Okay.
And hopefully give you the knowledge you need to make really informed decisions about your spinal health.
Yeah, that's right. We really want to kind of take the mystery out of this condition and, really give you, the listener, a sense of control over your well-being, especially for those of you who are older adults or caring for someone who is.
But when I first started looking into this, I was a little bit surprised to learn that degenerative disc disease isn't really a disease at all.
Right.
It's more like a natural part of aging.
It is. Yeah.
Right.
The name can be a little misleading.
Okay.
Think of your spinal discs like those little gel cushions that you might have in your shoes. They act as shock absorbers between the bones in your spine, and they allow you to bend and move freely.
Okay.
But over time, those cushions or discs can start to wear down.
Okay. So that makes sense.
Yeah.
It's kind of like, how kids, they seem to bounce back from anything.
Exactly.
Like their discs are still young and resilient.
When we're young, our discs are full of fluid, making them really plump and springy. But as we age, they start to lose that fluid and dry out.
Okay.
And you might even get tiny cracks and tears in the outer layer, much like a well-worn cushion.
So less padding, less bounce.
Yeah.
What happens inside the disc itself as it ages?
Well, as the disc loses fluid, it becomes thinner
Okay.
and less able to absorb shock. And those tiny cracks and tears I mentioned can actually lead to a breakdown of the inner core of the disc.
Yeah.
And it's this breakdown that can cause a cascade of events, sometimes leading to pain and other issues.
And this is where those bone spurs come in, right?
Yeah.
I read that the body starts growing this extra bone
That's right.
around the discs.
Yeah.
Almost like the spine's trying to build its own little support system.
That's a great way to put it. Your body senses that instability.
Yeah.
And tries to compensate.
Okay.
So imagine those bone spurs, like scaffolding around a building. They're trying to add support and stability to the spine.
Right.
Unfortunately, sometimes those bone spurs can end up pinching nerves, which can cause pain and affect how the nerves function.
So it sounds like aging is kind of the main culprit here. But are there other things that can speed up this process of degeneration?
Yes, absolutely.
Okay.
Smoking is a big one because it restricts blood flow to the spine. It essentially deprives those discs of the nutrients they need to stay healthy.
Wow.
Heavy lifting and being overweight can also put excess strain on the spine, which accelerates that wear and tear on the discs.
So things like, maintaining a healthy weight and avoiding smoking
Absolutely.
can actually make a difference potentially.
Absolutely. Those are lifestyle choices that can have a significant impact on your spinal health in the long run.
Now, what about sudden injuries?
Yeah.
Can those contribute to degenerative disc changes as well?
Yes. A sudden injury like a fall or a car accident can definitely trigger changes in the discs. It can be like accelerating that wear and tear process we talked about.
Okay, so we've got wear and tear, we've got lifestyle choices, we've got injuries.
Right.
Now, I found this next part really fascinating. You're telling me that some people with degenerative disc disease don't even experience any pain.
That's right. And it's a very important point.
Wow.
Experiences with degenerative disc disease can vary widely.
Okay.
Some people experience, significant pain and discomfort. Others might have no symptoms at all.
Really?
They might only discover they have disc degeneration, incidentally, like during an X-ray for a completely unrelated reason.
So it can be completely silent for some people.
It can.
That's amazing, but also a little confusing.
Right.
Like if you don't have any pain, how do you even know if you have it?
That's where a good physical exam comes in.
Okay.
A doctor will assess your range of motion, check for tenderness, and look for signs of nerve involvement.
Okay.
They'll ask about your medical history and any activities that might be aggravating your symptoms if you have any.
I see. So it's not always as simple as just taking an X-ray.
Exactly. X-rays can be helpful for ruling out other conditions or confirming the presence of bone spurs.
Right.
But they don't always tell the whole story. And for those who aren't experiencing any symptoms, an X-ray might not be necessary at all.
So let's say you are diagnosed with degenerative disc disease.
Okay.
What happens then?
What are the treatment options?
Well, if your pain is mild, self-care might be all you need initially.
I've heard that heat therapy can be really helpful for back pain.
It can.
Like I found just, applying a shooting pad to my lower back can work wonders when it acts up.
You're right. Heat can be very soothing for back pain.
Mm-hmm.
Ice, over-the-counter pain relievers, and gentle stretching can also be effective for managing discomfort.
But what if those measures aren't enough?
Okay.
What happens when the pain is more severe or you start developing other complications?
That's when additional treatment might be necessary.
Okay.
Sometimes degenerative disc disease can lead to other conditions, like osteoarthritis, a herniated disc, or something called spinal stenosis.
Okay. I've heard of osteoarthritis and herniated discs.
Yeah.
But what exactly is spinal stenosis?
So imagine the spinal canal, the space where your spinal cord runs, as a tunnel.
Spinal stenosis is essentially a narrowing of that tunnel, which can put pressure on the nerves and cause pain, numbness, or weakness. And it often occurs in the lower back or neck. Think of it like a traffic jam in your spine.
So you have this narrowing of the space around the nerves, and that can lead to a whole host of problems.
Exactly.
What kind of treatments are available for these more complicated situations?
Well, physical therapy is often recommended to strengthen and stretch the back muscles, which can help improve support and stability for the spine.
I can see how strengthening those muscles would be really helpful. What about medications or surgery?
Yeah.
Are those ever part of the treatment plan?
Sometimes your doctor might prescribe medications to help manage pain and inflammation. Surgery is typically considered a last resort when other treatments haven't provided sufficient relief and the pain is significantly impacting your quality of life.
So the goal is really about managing the pain, maintaining functionality as much as possible.
Exactly. We want to help you live a full and active life, even with the natural changes happening in your spine. And remember, each individual's experience is unique. Treatment plans should be tailored to your specific needs and circumstances.
That's really reassuring to hear. So it's not a one-size-fits-all approach. Now, I know a lot of our listeners are caregivers for loved ones who are dealing with back pain and maybe even degenerative disc disease. What are some things that they should keep in mind when providing support?
That's a great question.
I
think the first and most important thing is understanding the nature of the condition itself. Caregivers need to recognize that degenerative disc disease is a process, not a one-time event. The symptoms might fluctuate with periods of greater or lesser pain. So patience and understanding are key.
It sounds like a lot of emotional support is needed, too.
Absolutely. It's crucial to encourage open communication about pain levels and limitations. It's about working together to find ways to adapt and manage daily activities and making adjustments as needed.
So creating a supportive environment where their loved one feels comfortable discussing their pain and their limitations.
Exactly. Caregivers can also help create a supportive physical environment at home.
How so?
For example, they might modify furniture to make it more comfortable, ensure proper lighting to prevent falls, and assist with tasks that might be difficult or painful.
That makes sense.
So
easing their burden in practical ways around the house.
Those everyday tasks can become challenging
when you're dealing with back pain. And it's important to remember that caring for someone with chronic pain can be physically and emotionally demanding for the caregiver as well.
Oh, absolutely,
They need to prioritize their own well-being to avoid burnout.
Self-care for the caregiver is so crucial.
Yes.
It's like that saying about putting on your own oxygen mask first before helping others.
That's a great analogy. Caregivers need to take breaks, connect with support groups, and practice relaxation techniques. They need to take care of themselves so they can effectively care for others.
What about exercise? We talked about physical therapy, but is there a role for exercise in general?
Yes.
For both people with degenerative disc disease and their caregivers?
Absolutely low-impact exercise, like walking, swimming.
I love swimming. It's so gentle on the joints.
Exactly. And yoga can be very beneficial.
It's about finding activities that strengthen muscles, improve flexibility, and promote overall well-being without putting excessive strain on the spine. Of course, it's always best to consult with a healthcare professional before starting any new exercise program.
That's great advice. So we've covered a lot of ground here.
We have.
As we kind of wrap up this part of our deep dive, what would you say are the most important takeaways for our listeners today?
I think the main takeaway is understanding that degenerative disc disease is a normal part of aging for many people.
Right.
It doesn't necessarily mean a life filled with pain. There are things you can do to manage symptoms, stay active, and maintain a good quality of life.
So knowledge is power.
Absolutely.
Yeah.
And for our listeners who are caregivers, remember the importance of patience, communication, and support.
Right.
Create a safe and supportive environment where your loved one feels comfortable sharing their needs and challenges.
And don't forget about self-care.
Yes.
Taking care of your own well-being is essential to providing effective care for others.
It is.
We've learned so much in this first part of our deep dive into degenerative disc disease. But before we move on, I have a thought-provoking question for our listeners. Knowing what you now know about degenerative disc disease, what steps can you take to keep your spine healthy as you age? We'll explore this further in the next part of our deep dive, so stay tuned.
That's a great question to consider. You know, we've touched on some key factors like maintaining a healthy weight, avoiding smoking, and engaging in regular low-impact exercise.
Right. Those are all great starting points. But I'm curious, are there specific types of exercises that are particularly beneficial or maybe even harmful for people with degenerative disc disease?
That's an excellent question, and the answer can depend on the individual and the severity of their condition. But in general, exercises that strengthen the core muscles, which support your spine, are incredibly important. Think of your core as a natural corset for your back.
So planks, crunches, that kind of thing.
Exactly. But it's not just about strength. Flexibility is also crucial. Gentle stretching exercises like yoga or Pilates can help improve range of motion and reduce stiffness.
I've heard that yoga can be really helpful for back pain. But I've always been a little intimidated to try it. Any tips for beginners?
I'd recommend finding a qualified instructor who specializes in therapeutic yoga for back pain. They can guide you through modifications and ensure you're practicing safely and effectively.
That's helpful advice. No, we've been focusing on things that people can do to, manage their symptoms and improve their spinal health. But are there any new or emerging therapies on the horizon for degenerative disc disease?
There are some exciting developments in the field of regenerative medicine that hold promise for the future. Researchers are exploring techniques like stem cell therapy and platelet-rich plasma injections to promote disc regeneration and healing.
Well, that sounds almost futuristic.
It is.
Are these therapies widely available yet?
Not quite. They're still in the experimental stages, but the early results are encouraging.
Interesting.
It'll be interesting to see how these therapies evolve in the coming years.
Definitely. Now, I want to shift gears a bit and talk about the emotional impact of living with chronic back pain, which can be significant.
It can.
What advice would you give to our listeners who are struggling with this aspect of degenerative disc disease?
It's important to acknowledge that pain is not just physical. It has an emotional component as well. Chronic pain can lead to feelings of frustration, sadness, even anger. It can affect your mood, your sleep, your relationship.
It can feel very isolating.
It absolutely can. It's essential to seek support, whether that's from loved ones, support groups, or a therapist. Talking about your experiences and feelings can be incredibly helpful.
Are there any specific strategies or techniques that can help manage the emotional stress of living with chronic pain?
Mindfulness-based stress reduction techniques have shown promise in helping people cope with chronic pain. It involves focusing on the present moment, observing your thoughts and feelings without judgment.
So it's about learning to accept the pain rather than fighting against it.
In a way, yes. It's not about ignoring the pain,
right,
but rather learning to approach it in a different way with curiosity and acceptance.
That's fascinating.
Yeah.
I can see how that shift in perspective could be really helpful.
Yeah.
Now, before we wrap up, I want to touch on the topic of nutrition.
Okay.
Does what we eat play a role in spinal health and degenerative disc disease?
It definitely can. A healthy, balanced diet is crucial for overall health.
Yeah.
And that includes the health of your spine.
So are there any specific foods that are particularly beneficial or harmful for disc health?
Foods rich in antioxidants, like fruits and vegetables, can help fight inflammation, which is often a factor in degenerative disc disease.
Okay.
Omega-3 fatty acids,
Okay.
found in oily fish like salmon and tuna, can also have anti-inflammatory effects.
So loading up on colorful fruits and veggies and getting enough healthy fats.
Yes.
What about things to avoid?
Processed foods, sugary drinks, and excessive amounts of saturated and trans fats can contribute to inflammation and weight gain, both of which can negatively impact spinal health.
It sounds like a lot of the same advice we hear for overall health. You know, eating a balanced diet, staying active, maintaining a healthy weight.
Exactly. Taking care of your overall health is one of the best things you can do for your spine.
You know, we've talked a lot about the physical and emotional aspects of degenerative disc disease, but I'm wondering about the practical side of things.
Okay.
Are there any like ergonomic adjustments or assistive devices that can make daily life easier for people with back pain?
There are many simple things like using a lumbar support pillow when sitting can make a big difference.
I actually have one of those in my office chair.
Great.
I find it really helps with my posture.
It's amazing how such a simple tool can have such a positive impact.
Other things to consider are adjustable desks, ergonomic keyboards and mice, and even something as simple as a grabber tool to reach items without bending over.
Those sound like really practical solutions that can make a big difference in someone's daily life.
Absolutely.
Yeah.
And if someone is struggling with mobility, they might benefit from assistive devices like canes, walkers, or even wheelchairs.
It's all about finding ways to adapt and make life easier and more manageable, right?
Exactly. And remember, it's important to work with healthcare professionals like occupational therapists who can assess your individual needs and recommend appropriate modifications and devices.
So as we wrap up this part of our deep dive, what are some key takeaways for our listeners, especially those who might be feeling overwhelmed or discouraged by a degenerative disease diagnosis?
I think the most important message is one of hope and empowerment.
Yeah.
While degenerative disc disease is a common part of aging old, that doesn't have to define your life.
It's not a life sentence.
Exactly.
Right.
There are things you can do to manage your symptoms, improve your quality of life, and continue doing the things you enjoy. Don't be afraid to advocate for yourself. Ask questions. And seek support from healthcare professionals and loved ones.
That's a powerful message.
It is.
And remember, you're not alone on this journey.
You're not.
Now, as we head into the final part of our deep dive, I want to leave our listeners with a thought to ponder. How can you shift your perspective on degenerative disc disease from one of fear and limitation to one of acceptance and empowerment? We'll delve into this further in our next segment. That's a great question to think about. You know, it's easy to feel overwhelmed by a diagnosis.
It is.
But I think there's a lot of power in reframing our mindset.
Absolutely.
Right.
One way to kind of shift your perspective is to focus on what you can control. You can choose healthy habits.
Prioritize movement and seek out support when you need it. It's about taking an active role in your well-being rather than feeling like a passive recipient of a diagnosis.
I love that, taking an active role. It reminds me of something we discussed earlier about self-care and advocating for your own needs.
Right. It's about becoming your own best advocate. Don't be afraid to ask questions. Do your research and explore different options until you find what works best for you. It's your body, your health, your journey.
And sometimes that journey might involve setbacks. Right?
It might.
How can people cope with the ups and downs of living with degenerative disc disease?
That's a really important point. Living with a chronic condition like this is not a linear path. There will be good days and bad days. Learning to ride those waves, to accept the ebbs and flows, is essential for long-term well-being.
So it's about embracing the reality of the situation.
It is.
While still striving for the best possible outcome.
Exactly. And remember, you don't have to go through this alone. Lean on your support system, connect with others who understand what you're going through, and celebrate those small victories along the way.
That sense of community and shared experience can be so powerful.
It can.
Now, as we wrap up this deep dive into degenerative disc disease, I want to circle back to a point you made earlier about the importance of prevention.
Right.
What are some things people can do throughout their lives to maintain a healthy spine and potentially slow down that process of degeneration?
Great question. It's never too early to start prioritizing spinal health.
Okay.
Think of it like investing in a retirement fund.
Yeah.
The earlier you start, the better off you'll be in the long run.
So what are some key investments we can make for our spines?
Maintaining a healthy weight is crucial, as we discussed earlier.
Right.
Excess weight puts strain on the spine and can accelerate wear and tear on those discs.
No.
Regular exercise,
Okay.
particularly core strengthening and flexibility exercises, is essential for building a strong and supportive foundation for your spine.
It's like building a strong core for life.
Exactly. Okay. And don't underestimate the power of good posture.
Okay.
Whether you're sitting, standing, or lifting, pay attention to your alignment.
Yeah.
Imagine a string pulling you up from the crown of your head, lengthening your spine, and engaging your core.
Those are all great tips. Any other pearls of wisdom for our listeners before we sign off?
I'd encourage everyone to listen to their bodies.
Okay.
Pay attention to those early warning signs of pain or discomfort.
Yeah.
And address them promptly.
Okay.
Don't try to push through pain.
Right.
Seek professional guidance when needed.
Yeah.
Remember, you are the expert on your own body.
That's such an empowering message.
Yeah.
You are the expert on your own body.
You are.
What a fantastic note to end on.
It's been a pleasure diving deep into this topic with you.
Thank you for joining us on this journey of discovery into degenerative disc disease. We hope you leave feeling informed, empowered, and hopeful. Remember, knowledge is power, and with the right tools and mindset, you can navigate the challenges of degenerative disc disease and live a full and active life. Until next time, stay curious and keep exploring.